Welcome to today's webinar, brought to you by Orchard Technologies. Orchard Technologies is a global leader in oral fluid substance abuse testing products. Their unique assays provide accurate and easy-to-administer testing methods to help determine the presence or absence of drugs or alcohol in a person's system. Oral fluid-based testing products provide a simplified collection process, faster results, cost savings with minimal risk of tampering, and dramatically reduced risk of adulteration. The Intercept Oral Fluid Test is an FDA-cleared laboratory-based oral fluid drug testing system that enables accurate testing for drugs of abuse, including marijuana, cocaine, PCP, amphetamines, and opiates. With a fast and easy-to-administer collection process, Intercept is ideal for the workplace, criminal justice, drug treatment centers, and clinical setting screening programs, among others. Today's presentation is entitled, How to Determine the Value and True Cost of Drug Testing in the Workplace and Occupational Health Markets, and will be presented by Bill Current and Joanne Briscoe. Bill Current is the president and founder of WFC & Associates, a national consulting firm that specializes in drug testing policy development and providing accurate and up-to-date state drug testing law information. He is the editor of the online Ultimate Guide to State Drug Testing Laws at statedrugtestinglaws.com and the publisher of the e-newsletter State Drug Testing Laws Monthly and the weekly e-news service Drug Testing in the News. Joanne Briscoe is the marketing manager for Shawnee Mission Corporate Care, an occupational health network consisting of 5 clinics in Kansas and Missouri. Joanne has worked in the occupational health field for 25 years and has been a solution-oriented resource to employers regarding environmental safety and health practices and the efficacy of drug testing in the workplace. It will now be our pleasure to hear from Bill Current and Joanne Briscoe.
Well, thank you very much, Jessica, and hearty good afternoon and welcome to our audience today. As Jessica mentioned, we're going to talk about determining the value and true costs of drug testing, not only in the workplace but in the occupational health market as well. And I'm really excited about presenting today with Joanne Briscoe from Shawnee Mission Corporate Care, an organization that is co-sponsoring today's webinar with Clinical Reference Labs. Some of you in the industry, in the drug testing industry, may know them as CRL. Together they are co-sponsoring with Orchard, and I'm really excited about Joanne's part of today's presentation. I think you're going to really like it. She's got some great insights from her years of experience working in the occupational health industry. Now, if you saw the invitation that was sent out, this is the language from it. I'm not going to go into all of this, but essentially we're going to talk about the real costs of drug testing, not just what you get billed by the lab or the TPA, but all the different costs that go into it, whether you're doing urine collections and sending that off to a laboratory, whether you're doing an alternative or an advanced testing method. And so the first point I want to make is that drug testing works. So this is not a presentation that's intended to make a particular testing method seem inferior to others. If you've ever heard me give a presentation before, you know that I am a proponent of drug testing and that any drug testing method can work if it's done right. But there are some challenges that are involved in doing certain kinds of drug testing versus others, especially during the collection process. But drug testing itself, when done right, works. Some alternative testing methods are worth considering versus the traditional testing method. So a traditional testing method is collecting a urine specimen from a donor, transporting that specimen to a laboratory overnight. The laboratory then conducts a preliminary test on that sample, and if it's positive, or the terminology non-negative, then the laboratory will conduct a confirmation test, usually gas chromatography, mass spectrometry. And if that result is confirmed positive, then an MRO, a medical review officer, attempts to verify it by contacting the donor, finding out if there's some type of legitimate medical explanation for that confirmed positive result. And the MRO will verify the result one way or the other. Once the result is verified, it's then reported to the employer according to whatever applicable law may apply. Some state laws require the result to go through the MRO, others through other means, some directly to the employer. But this is the traditional testing method. There are, however, some pros and some cons to urine testing. Of course, it's accurate, it's legal in all 50 states, and it works. It's been around for a long time, and it is the only method that is currently permitted under the SAMHSA regulations, the Substance Abuse and Mental Health Services Administration regulations. Therefore, it's the only method currently allowed for DOT testing. However, if you're in the business, you know that SAMHSA is in the process of developing regulations for lab-based oral fluid testing. So a little bit more on that in a second. Some of the cons, some of the disadvantages to traditional urine testing is, well, it's urine, and not everybody's comfortable either requiring their employees to provide a urine sample, or they're not comfortable collecting it themselves in the workplace. It does take time to collect a urine sample. There's no way around that, and time is money. And of course, as many people know and understand, urine drug testing is highly susceptible to drug test cheating. There are thousands, literally thousands of websites. You could do a Google search on drug testing or on passing a drug test or even drug test cheating, and you're going to find dozens upon dozens, even thousands of websites offering free advice to expensive products and additives, etc., that are all guaranteed to help someone who shouldn't be passing a drug test to successfully pass their drug test, because urine is susceptible to drug test cheating. It's become a cottage industry. Now, lab-based oral fluid testing as an alternative also is accurate. It is legal in 47 out of 50 states, and it works. Now, let me go back and clarify something. When I say it's legal in 47 out of 50 states, you have to understand that when it comes to state drug testing laws, and that's something that here at our company we specialize in. We have a website called statedrugtestinglaws.com. So we track these laws literally every day of the week. When the vast majority of state drug testing laws were written and passed, it was years and years before the advent of newer technologies like lab-based oral fluid testing. So many of these laws don't technically prohibit or don't intentionally prohibit lab-based oral fluid testing. It's just back in the day when they passed their law, lab-based oral fluid testing really wasn't around per se for the workplace, and so it's limited or left out de facto by the fact that it really wasn't there to be considered. The vast majority of states do allow it, though, and some states have actually gone back in and amended their state laws to specifically permit some of these advanced testing technologies like lab-based oral fluid testing. And in terms of producing, positive results and things of that nature, which I'm going to get into in a second, it works. Now, compared to the disadvantages of urine testing, well, of course, it's not urine. And so many of the issues associated with urine, whether it's during the collection process or if it happens to be a corporate culture issue, whatever, those issues go away. Typically, it takes a lot less time to collect an oral fluid sample than it does a urine sample. Therefore, it costs less. And it's really not susceptible to drug test cheating. Now, I say virtually drug test cheating proof because perhaps there is somebody out there that's found a way. But I've done a lot of research on this, and today's webinar is not about drug test cheating, but I will tell you that one of my favorite websites when it comes to drug test cheating is a website that gives advice on how to pass an oral fluid drug test. And the best advice that they have is avoid giving them a sample of your saliva. And it says it right there on the website. If they get your saliva, you're going to test positive because there's virtually no way to cheat on an oral fluid drug test. So some of those issues that are really concerns when it comes to urine testing go away when it comes to oral fluid testing, particularly lab-based oral fluid testing. So just like with urine, results can be available within 24 hours for negatives. As I said, it's legal in 47 states. It's legally defensible as a technology because it's been around for a while now. It is considered accurate. It has passed legal scrutiny. Certainly from a scientific standpoint, it is widely accepted, and proof of that is the fact that the federal government is now in the process of developing regulations for lab-based oral fluid testing that when they become finalized will make it possible for many companies that are mandated under federal laws to do drug testing, which right now is limited in workplace situations to lab-based urine testing. It'll make it possible for those companies to also do, in addition to or instead of, they'll be able to do lab-based oral fluid testing in addition to or instead of urine testing. So that's going to be a great development as that comes about, but it underscores the fact that the science of lab-based oral fluid testing has arrived. It's there. It's been there for a long time, but the federal government has finally recognized it, and they're developing regulations to permit it, and the Department of Transportation has already publicly signaled that once those SAMHSA regulations come out for lab-based oral fluid testing, they're going to allow lab-based oral fluid testing under DOT regulations as well. That'll take time, of course. It's not going to happen overnight, but it's in the process of happening, and that's a good thing when it comes to having more options available to you if you're under these federal mandates. It is, however, compared to other testing methods, a more accurate way to detect recent use. And I've got a chart that I'm going to show you in a minute to sort of underscore that. And as I mentioned, it's virtually adulteration-proof. You're going to really have a very difficult time finding anyone or any product that can really successfully help somebody cheat on a lab-based oral fluid test. Now, when it comes to oral fluid testing, it is very, very important that you compare the cutoff levels that a product claims to be able to detect the number one drug of abuse, THC, or marijuana, THC being the psychoactive ingredient in marijuana. Now, that red dotted line that you see going vertically up and down about halfway along the chart is the 50 nanogram level, okay? So all of the blue bars to the right were positive above 50 nanograms, but all of those blue bars to the left, those really tall ones, those are the ones who were positive under 50 nanograms. And you can see that the vast majority, 80% of THC positives are below 50 nanograms. And if you just kind of scan over to the left even further, you can see that the majority of them are under 20 nanograms per milliliter. So cutoff levels make a difference. And I mentioned this in particular because the cutoff levels with lab-based oral fluid testing are much, much more sensitive and accurate than with most instant oral fluid testing products. In fact, to my knowledge, there's only one instant oral fluid product that is FDA cleared. The rest are not. But a lab-based oral fluid testing program like the Intercept device from OraSure and others are FDA cleared not only for the device, but you want to make sure they're cleared also for the particular drug or the assay that you're testing for. And if you're interested in a broad or wide panel of drugs, then you again, many products can test for many drugs, but you want to make sure that every drug you're testing for, that assay is FDA cleared with that product. And so you're looking for one that has a wide range. I think with the Intercept it's 9, and that's the most drugs that are FDA cleared through any oral fluid testing method. But you want to make sure it's not just being able to detect the drug, but having that FDA clearance is very, very important. Now, when I talk about oral fluid testing, one of the things I always get asked is, what about the window of detection? I hear that it's microscopic with oral fluid testing. Well, microscopic is not an accurate way to describe it. But let me illustrate this using this chart in front of us. Okay, so on the far left, that black line is, the moment of ingestion of a drug. I mean, it's right when it happens. And you can see the blue and the red bars, or lines, red standing for blood and oral fluid is the blue line. Those start, the detection level, the window of detection opens up almost immediately after an individual has used a drug. With urine, there's a lag time. You see the yellow one? There's a lag time of about an hour or so. Depends on the drug, etc. Okay? Now with hair testing, you can see that the window of detection starts days after the person used drugs, but look how far over to the right it goes. The window of detection with hair testing does start late, but it goes on for about 3 months, about 90 days. Now with urine, it starts about an hour or so late, but it goes out a little bit further than oral fluid and blood. But when we talk about a detection method for recent use, if you're concerned about that, say in a reasonable suspicion scenario or in a post-accident testing situation, you're going to want that immediate ability to detect drug use. Let's say somebody goes out in the parking lot and smokes a joint. Even in a state where marijuana is legal like Colorado, you're going to want to know if when they come back in and they smell like marijuana and they're back on the job and your policy prohibits them from being at work under the influence of marijuana, you want to know that. Well, if they just smoked a joint out in the parking lot, it's going to be an hour or so before that that usage is detectable with urine. But with oral fluid, it's going to be virtually immediately after they use the drug. Therefore, it is a more accurate indicator of recent drug use. And you only get that kind of immediate detection ability with one other specimen, and that's blood, which is impractical for the workplace in most situations and actually illegal by state law in many states. So the window of detection is a very, very important factor when it comes to any testing method, but in particular when you're talking about oral fluid testing versus other testing methods. All right? Now, the other question I always get is, what about positivity rate? I hear that oral fluid testing is not as accurate as urine. Well, I don't know if that was true 15 or 20 years ago, but it's certainly not the case today. This is just one example of literally millions of specimens being monitored for positive by these different drugs that you see in the left column, and then the middle column is the intercept device. Let's call it generically the lab-based oral fluid testing column, and on the right is the urine testing column. And so you can see at the very top the positivity rate for comparing these two is pretty close, 4.1 for oral fluid testing, in this case using the intercept device from OraSure, and 4.4% with urine. But this is the catch. Scan down the chart and stop at the line that says THC. It's actually higher. The positivity rate under the intercept column is actually higher, 2.5, than it is under urine, 2.3. And that goes to the point where it sort of dispels this common myth about lab-based oral fluid testing. In particular, I'm talking about lab-based oral fluid testing. I don't think that the percentages would be the same with instant oral fluid testing. But in the case of lab-based oral fluid testing, we're talking about a testing method that is comparable to, and in some cases actually yields more positives for the #1 drug of abuse in the United States, marijuana. So that should not be a concern. When you compare the positivity rates of oral fluid, lab-based oral fluid testing, with lab-based urine testing, you can see that it's pretty comparable. And the lab-based urine testing, picks up most of its advantage in the amphetamine column. Doesn't mean that you can't detect it with lab-based oral fluid testing. You can. But that's where most of the difference in the 4.1 versus 4.4 at the top comes from. And interestingly enough, because lab-based oral fluid testing is typically criticized as not being able to accurately or with the same sensitivity level pick up THC, actually the data from these millions of tests that were sampled and monitored actually shows that's not the case, that with lab-based oral fluid testing, you can detect marijuana, even maybe get a few more positives than you can with urine. Now, an oral fluid collection, and this is going to segue into Joanne's part. An oral fluid collection is handled much differently than a urine collection. Some of the issues that come up with urine collections go away entirely when it comes to oral fluid collections. For example, you don't have to match the gender of the technician for the collection with the gender of the donor, because there are no privacy issues involved. We're not using bathroom stalls. We're not having to secure the hot water and turn that off. We're not putting blue dye into the toilet water or any of the other myriad things that you do to secure a restroom to be a place where urine can be collected for drug testing purposes. Observed collections, not a problem, because the administrator of the test and the donor are right there in front of each other the entire testing process. That's why unions love oral fluid testing, because there's never any question that some kind of monkey business took place during the collection process, because the donor and the administrator of the test are always right there next to each other, viewing the entire process from one direction to the next. All the embarrassing issues that sometimes are associated with collecting a urine sample go away. And the shy bladder issues go away, the time that it takes to do a collection go away, and there's a lot of flexibility, because if you're working, say, a 24-hour shift, you've got graveyard shifts, etc., you're working weekends, you're working holidays, you're in remote locations, etc., you can actually collect the oral fluid sample with employees who have been trained to do it, not even needing to necessarily use professional technicians, because it's that easy to do. And the manufacturers of the oral fluid devices can actually provide that training, and you can have any number of your supervisors or managers in a position where they can actually administer the test, ship it to the laboratory, just like the collection site would do with a urine sample, and get a result back within 24 hours. The vast majority of results are negative, of course. You're going to get those results back within 24 hours. If it's a non-negative during that screening process, then yes, it's going to take a little bit more time. But the majority are going to be ready within 24 hours, just like with urine testing. So you're not giving up anything on that way. You're not giving anything up in terms of the positivity rates. You're picking up some stuff because of the window of detection opening up immediately after drug use. There are some very attractive benefits to lab-based oral fluid testing, but again, it comes down to what is your objective with drug testing, what are you trying to accomplish, and then which testing method meets those needs best. Now, when it comes to occupational health centers providing this service or having individuals come in to void a sample, etc., there are different issues that you need to be aware of. And so at this time, I'm going to pass the ball to Joanne Briscoe from Shawnee Healthcare, or Corporate Care, excuse me, Shawnee Mission Corporate Care, and she's going to take us through a little bit more explanation from her perspective as somebody who's been in the Occ Health business for many years. And I think I just passed the ball to her.
Great. Thank you, Bill. I sincerely appreciate it. I have been working in occupational medicine for, over 20 years, and all of the specimen collection challenges that we've all been, presented with and employers are challenged with are some of the reasons why, as an occupational health provider, we looked to OraSure and the Intercept product to solve problems for our clients. Because basically our clients are looking to us to collect a defensible specimen, and they're also looking to us to do that rather quickly, to do it efficiently, because everyone's on the clock, and we have to meet the customer's expectations. So for all of these reasons, in an occupational health setting, I always felt that I had to offer the employers some alternative choices, because they're all faced every day in a specimen collection environment. We're all faced with temperature out of range, shy bladder, and probably one of the biggest issues that I hear from my clients is the issues of negative dilutes. DOT makes a statement with regards to negative dilutes as far as whether the employer can choose to collect another specimen. And employers are also faced with, some of those issues. So really, from a collection standpoint, when an individual comes into the clinic, they are, they can be detained in our clinic for, any reason. And certainly our collectors, they have to be, constantly aware as to, what some of the issues are in a clinic setting. So, we have, collection problems can be exacerbated from the fact that, people can bring in synthetic urine. People can, I did a seminar several years ago with some industry professionals on, how individuals can beat a drug test, some of the things that Bill was talking about. So it's just so easy in some instances, and certainly not everyone's going to beat a drug test, but we constantly have to be aware of all of the issues that present to us in an occupational health setting. And certainly in consulting with employers, and most of my employers have always invited me to meetings with their labor attorneys. And so I really had an opportunity to receive a lot of good information and a lot of good guidance that labor attorneys have given employers with regards to what their policy should look like. And probably the biggest issue that I see with employers is that basically they don't. Not every employer has access to human resources, and in an occupational health setting, we always felt that we did our very best to try and connect employers with industry professionals for good guidance. And in those situations, companies were were basically told from a omission standpoint that these are some of the probably most common omissions that an employer has in their drug and alcohol policy. I've reviewed, hundreds of drug and alcohol policies, and labor attorneys are basically still giving advice that, a good drug and alcohol policy should address what are the rules, what are the solutions, what are some of the consequences, because it's really a drug and alcohol policy that gives the employer direction as to what the next step is. They get in trouble when they make emotional decisions. So I've always, when I'm sitting in front of a customer, I've always asked them if their drug and alcohol policy addresses some of these issues. And because I'm trying to really drill down and figure out, what types of flexibilities they have in their policy, what their goals are as an organization. And I'm also trying to drill down and determine whether oral fluid is something that would really fit into their organization. So I had a client that just switched over to oral fluid last year, and she called me and she said, "Joanne, I'm really tired of all of the dilute specimens." And she said, "I'm ready to go to oral fluid." She said that basically, it's far more difficult to go with a labor attorney and to really figure out, all of the issues that come with the challenges of urine drug testing. That it was far less expensive, and it was an easier transition to just take all of that out of the equation and to go with saliva oral fluid. And probably I'm also trying to be very sensitive to how much a simple drug test really could cost an employer. So when I am working with an employer and we talk about urine drug testing versus oral fluid, I had a client last week that was a new business that was coming into our particular area. She confided in me that she advised individuals 3 weeks ago that they had the job and that they were, just getting set up with an occupational health program. And she says, "Well, I have all these individuals that are just waiting to take their drug test." And I said, "Well, if I could make a suggestion," and this was a company that came in from Europe, and I said, "If I could make a suggestion, I really feel that, saliva oral fluid would be a better alternative for you than urine." I said, "These individuals have known for 3 weeks that they're going to take a drug test. You're a new business," and it was very easy to talk about the benefits of oral fluid versus urine. And really, we had the discussion because I was really trying to give guidance and to protect the employer so that they could get the best drug test that they possibly could, and that they could get the most accurate defensible specimen, because they were pulling from labor pools all over the city, and it was just, she appreciated that information. But when I also talk with employers, I'm also trying to get a feel for and try to explain to them that, if something could go wrong with a drug test, and if we are presented with any of the challenges, if we do get a specimen that's out of range, if we are presented with a shy bladder situation, I kind of go through this slide with them and say, these are some of the issues that you could be presented with, and do you really want to pay? And of course, these are average costs, and they may be a little less, they may be a little more in your particular areas, but it really, this really kind of paints the picture and tells the story because don't forget that employers, the general admissions and their drug and alcohol policies they're not aware in a lot of instances that saliva oral fluid even existed. And a lot of times, depending upon the employer, they're also not aware that, why the individual was even detained in our clinics. So, they're so busy trying to do other things, all they really care about is they want a result. And in some instances, when you paint a picture and show them that when they get an invoice, this is the reason why this drug test was so expensive, and you start to go through the methodology, then they really are making a very different decision as to what type of drug test is really best for them. So I am in every situation, and it's not perfect in every situation. There are some employers that are, whether it's industry-wide, corporate-wide, the decision is still urine. But it still does not prevent me from educating. In the occupational health business, I always felt that it was my job to offer solutions and to give guidance. And primarily I did that because I'm trying to, as a market differentiator, we want to do what's right for the customer. And in those instances, whether they have an opportunity, I know we're all in the business to make a profit, but I always felt it was the right thing. If I could save a customer money, then that was the right thing to do. And so in a selling situation, I'm always educating that, these are alternatives that you can have within your organization and certainly within your policy. And we also kind of really go over, the wage and productivity costs. That factor in. I had a particular client that gave me, early on in my career, gave me a document that because the employee was detained in our clinic for more than 45 minutes, he gave me a letter that outlined exactly what it cost him in the driver not making his delivery run on time, what it cost him in penalties, what it cost in bonuses, what it cost in mileage, because we did not get his employee in and out of the clinic very quickly for a urine drug screen. That's because sometimes there are delays on the clinic side, sometimes there's delays from a donor standpoint. So I feel that it's very important to kind of, again, tell the story and paint the picture for an employer that this is an expectation. This is how much time your employee could be away from the clinic. On a good day, if everything works really well, if they're traveling 15 minutes to and from the clinic, and it's going to take them 30 minutes to accomplish their drug test in the clinic, that's a great situation, and it's 1 hour. But as soon as you enter a challenge, and whether that's a temp out of range or they're unable to void, then that's when the minutes start to click. And this is when an employer has to realize that it's not only the cost of the drug test. So we're trying to educate the employer that, again, they have some choices that will affect. And I always tell that story about that particular employer that made it very, very clear to us how important it is to get his employee in and out of our clinics for all the right reasons and collecting a good specimen. So the other things that factor into wage and productivity is, we look at the loss of the supervisor's time when the employer chooses to escort an individual to the testing facility. They're losing productivity because they're away from their job. Just doing some research, U.S. manufacturing, $24.56 an hour, certainly, that's an average based upon the other job positions that are out there. but I find that employers are becoming far more sensitive to how quickly can we get this done. And if we cannot get it done within 30 minutes in our clinic, they want to know, because they have to prepare and their lives have to go on. So these are and companies are also beginning to realize that productivity is also a huge factor, and that saliva oral fluid is an alternative that will improve that productivity. So this is just a slide, again, that I use that explains the process to an employer so that they understand from a cost standpoint, from an efficiency standpoint, that these are some of the options that they can certainly address in their drug and alcohol policy. We advise employers that that a simple drug test really doesn't always come with very simple costs, and we also recommend to the employer that as a best practice, that in their drug and alcohol policy they should include urine, saliva, oral fluid in their policy as alternative testing methods, so that this way, regardless of what card they choose to play, that their policy covers them. And because the policy is really going to direct what the consequences are and what the rules of the game are from an employer standpoint. And this is just another description of temperature out of range. And I find, especially with employers that are not DOTs, certainly, in a clinic standpoint, we follow the DOT guidelines when we're collecting a specimen, and more employers are putting in their policies that, because DOT is the gold standard, that they'd like to adhere to the same guidelines. Certainly, they don't, on a temp out of range, the policy can direct as they choose, but we just feel that from an education standpoint, these are alternatives that an employer very much appreciates, and they appreciate our sensitivity to some of their challenges in running their own businesses. So I am going to pass the ball back to Bill. Thank you very much.
Thank you, Joanne. Let me ask you a couple of questions, Joanne, before I continue. Now, just for the sake of our audience, to let you know, we've got some ROI models that we're about to demonstrate for you, so that's what's next, coming up next. But as I was going through, or I was listening to Joanne's presentation, a couple of questions came to mind. So at the very beginning, you talked about how basically when a client comes in and they're willing to consider an alternative testing method, such as lab-based oral fluid testing, usually there's some type of problem that they're trying to solve. And they're looking to you to provide a quick and efficient way to sort of address that issue. So specifically, and you kind of addressed these, but just to kind of summarize them in a nutshell, what are the main issues that employers will come to you with that you see, sort of solving those issues with oral fluid testing?
Probably the number one issue is negative dilutes. The number two biggest issue is time away from the office. They're so afraid that the individual will come into the clinic and maybe not always be honest about whether they can void or not. And because so many individuals know they kind of have 3 hours to produce that specimen, employers are truly not willing to take the risk of having that individual sit in our clinic for up to 3 hours, and they aren't in control of the situation. And that's where oral fluid comes in, where they're starting to take charge and say, you know what, I know my employees will take advantage of the situation, and I know they'll sit in there for a couple hours and read the magazines when they could really be at work, I'm not willing to take that risk anymore, and we want to cut over to oral fluid now.
Okay. Now, one of the questions that gets submitted, and I usually save the questions for the end, but I'm going to bring this one up now. I did refer earlier to the fact that 47 states directly permit the use of oral fluid testing. And to clarify, I'm talking about lab-based oral fluid testing specifically. There are some states that prohibit point of collection or instant testing. And so those states would not only prohibit instant oral fluid, they would also prohibit instant urine testing. Like Minnesota would be an example of a state that requires tests to go through a laboratory. But the three states I was referring to, so as to get back to Joanne's area where she works, are Maine, Vermont, and Hawaii, as well as the U.S. territory of Puerto Rico. So what are the states? I mean, basically the states you do business in, Joanne, we don't really have any problems with state laws prohibiting oral fluid testing.
No, we do not.
Is there sort of an understanding of that with the employers that you work with, or is that one of the things you have to clarify for them?
That is one of the things that we have to clarify.
Okay.
And that information is available through OraSure and Intercept.
Okay. So that is one of the big issues that comes up. I did a presentation a couple of years ago that we've actually repeated a number of times on the myths of oral fluid testing. And one of them is, and I think that some of the confusion for this is explainable, that oral fluid testing is not legal in many states. The truth of the matter is it's really just those three states, Maine, Vermont, and Hawaii, plus Puerto Rico. And the confusion comes in the fact that there are a number of states that do not allow point of collection testing, and as such it wouldn't allow point of collection oral fluid testing, but that doesn't apply to lab-based oral fluid testing. And then one other point of clarification, which is that there are a number of states that have what we call voluntary drug testing laws. So these are states like Florida, where I live, where the state offers a workers' comp premium discount program for companies that participate voluntarily in the state program. And under that state program, the testing, for the most part, and if you were here in the room, you'd see me doing those air quotation marks, for the most part, follows the SAMHSA guidelines, not precisely, but for the most part. And so, therefore, oral fluid testing wouldn't be permitted under the voluntary law. But outside of the voluntary law here in Florida, there are no restrictions on lab-based oral fluid testing. So that may be another thing that sometimes comes up that causes some confusion among employers. Here in Florida, for example, knowing what the state law says about, in the voluntary law, what it says about urine testing, and then equating that to all testing, and that's simply not the case. Well, Joanne and I will come back with some more Q&A towards the end, but I want to run you through these ROI models. There are a couple of explanatory slides coming up, but in the interest of time, I'm going to kind of go past those and assume that you know that ROI stands for return on investment, and there are lots of different things you can measure to determine whether something is worth your investment in it. Sometimes it's dollars, sometimes it's time, sometimes it's just alleviating frustration, and your return on investment in something is getting out of it what you're looking to get out of it. So when it comes to drug testing, let's compare lab-based oral fluid testing with the very popular and common lab-based urine testing. So the chart we're going to look at will show urine testing in that middle column and oral fluid testing in the yellow column. And we're going to look at several different cost categories. So the first one, the first line on there is the price the end user, the employer, is going to pay for collections. If it's through a third-party collection site, you're going to pay at least $15. If it's through a patient service center with one of the major labs, it's going to be a little less than that. But just for the sake of argument, let's go with 15. And then the price the end user, again, the employer, pays for the lab analysis. With urine, we're going to put in 18. With oral fluid testing, we're going to put in 25, but that's going to capture everything. That's going to be a bundled price, okay? The one thing that we're carving out, not being bundled for the urine testing side, is the MRO fee, which we're going to put at $5. That's going to bring the total cost of a lab-based urine test to $38 versus $25 for the oral fluid test. The next thing we're going to do is look at the time that it takes to do one test versus the other kind, and then what the cost is. But before we do that, let me say that if you've been in the drug testing business a while, or if you're a buyer of drug testing services and products, you know that the price of a drug test is determined by a lot of different things. But the two key factors are the volume of tests that you're doing and where those samples are going to be collected. So if you're using, again, a patient service collection site from one of the major labs, you're going to pay a lower amount versus using a third-party collection site. That's going to have a big factor. And then the lab is going to base its pricing in part on the volume of tests and the number of drugs in the panel and things of that nature. But it's going to have a lot to do with volume. Walmart, for example, which does over 1 million drug tests a year, is going to pay less per test than a small company that does 50 or 100 tests a year. Okay, so with those caveats out of the way, we've got $38 versus $25 right now, but that's not really, there's really more to it, okay? So let's look at lost work time. Joanne referred to it as time away from work, and there was a study that came out a few years ago that measured the time away from work to participate in a drug test. We're going to call it lost work time. The hourly rate for the worker in our equation is going to be $10.10, and the hourly rate for supervisor is going to be $24. The time that it takes to be away from the workplace to provide a urine sample at an off-site collection site is going to be 1.5 hours, and to provide an oral fluid sample in the workplace, let's say, is going to be 1/4 hour, okay, 0.25. And so we're going to do the math. 1.5 times $10.10 an hour for our average worker, that's $15.50 that you're paying that person to be at that collection site providing the sample. And as Joanne mentioned, sometimes that takes 3 hours to do. So now it's $30.30. We're just going to cut it to 1.5 hours. $2.53 for that same $10.10 an hour worker to do an oral fluid test. The supervisor is going to accompany that individual to the collection site at 1.5 hours, $24 an hour, $36 total, versus 1/4 hour of a supervisor's time for the oral fluid test, or $6 total. Excuse me, I'm starting to get one of those famous Florida colds, and so it's coming on in the summer, as they so often do. But now my bottom line, in time spent away from the workplace, lost work time, is $51.15 for urine and $8.53 for oral fluid. Now again, we're going to do the math. We're going to add it all up, and we learned that a typical urine test doesn't just cost the $38 that I'm being charged by the lab and the MRO and the collector. It's actually $89.15 because of the lost work time that's required to get that urine sample. Versus oral fluid at $25 for everything bundled together, and then $8.53 for lost work time. An oral fluid savings of 62.4%. Pretty significant. You want to look at what it really costs, okay? How about lab-based oral fluid versus, and I'm going to skip this slide. It's a little bit more of the same explanation, but lab-based versus instant urine testing. Lab-based oral fluid, versus instant urine testing. We're going to go through the same numbers, but look at, it's actually cheaper to do the urine test. You might do that urine test on site and eliminate the use of professional technicians. You're not going to have all the analysis of the laboratory. There is going to be the cost of the device and a fee for the MRO review, positives and negatives, or maybe just positives. We could actually jack up that $5 to a lot more than that if it's positives only, if we're just sending those off. But there are some states that require the instant test results to be reviewed by an MRO. Always a good practice anyway. But our bottom line price on this slide is $15 for urine and $25, the same price we had before with oral fluid testing. The time away from the workplace, even if I'm doing the urine collection on site, is still going to be a little bit more because it just takes a little bit longer to do urine collection, even for an instant test, than it does for oral fluid. And I think we're being generous by only charging half of 1 hour for the test, for lost work time for the individual and the supervisor. But my bottom line is, for time away from work, is $17.05 for urine versus $8.53, just like before, for oral fluid. Now again, I'm going to do the math, and now the price of the instant urine test versus the price of the lab-based oral fluid test Very comparable, $32 versus $33.53. Very, very similar. Now you have to ask yourself, what am I getting out of my drug test? What is it that I wanted to get? What did I hope to achieve with this test? Was it the convenience of an instant result that's available within an hour? Or do I still want the security of a lab-based result? And it's really up to you as the employer. If you're in the business of drug testing, as Joanne was talking about, like putting multiple options in the policy, as a seller of drug testing, you want to present multiple options to your buyer, because if they don't have options from you, they'll certainly find options from somebody else. One more example, and then we'll be done. Hair testing. Now, everybody knows that a hair test costs a lot more than other testing methods, but the price of hair testing has really come down. It's not comparable yet, but it's come down significantly from 5, 6, 7 years ago even, when it would have been $80, $90 perhaps for a hair test, or $60, let's say. I put in $35, which again is going to be affected by volume and things of that nature. I still do have to pay a collector, a technician, unless I'm training employees to do it. There's still going to be an MRO fee. My bottom line is going to be $55 for hair and $25 for oral fluid. Time away from work is a little bit more with hair testing if I'm sending them to an off-site collection site where that sample of hair is going to be collected. In that case, we're going to have a significant addition to our cost, about $51 for the hair test versus still at $8.53 for the urine. And now the hair test, it says urine there, but it really means hair. It's a typo, is really a little over $100 versus $33 for an oral fluid test. Now, I'm not really concerned about the cost differential between hair and oral fluid testing, because if I'm doing hair testing, it's because I want that longer window of detection. I want that 90-day view of this individual who's applied for a job with my company. So I'm willing to pay extra for that. If I'm doing hair testing, I know I'm going to pay more for it, but it's because I want the benefits that are unique to hair testing. So, you know, sort of apples versus pears there. Now, we're going to open it up to questions now. And we did have a couple of questions that were submitted. I'm going to take us through. And Joanne, let's make sure that your phone is not muted so that you can jump in at any point. The first question is, what is the cost of an oral fluid drug test versus the cost of a urine test? And again, without using actual dollar amounts, I threw some numbers up there. Those were just samples, okay? We could plug in different numbers. But the cost is somewhat comparable for the test, although with the lost work time, you're going to see quite a benefit when it comes to oral fluid testing. And I know, and Joanne, I'm not going to put you on the spot, so don't throw out dollar numbers, but when you present when somebody asks you the cost and you're presenting a proposal, do you explain that time away from work differential, and does that become a deciding factor for the buyer?
It does. It does. That is it is a general discussion for the global. It's a global decision, not just for the cost of the drug screen.
Okay. And we know that a lot of buyers, not all, but many buyers are very sensitive to the cost of the drug test. So are they able to, in their mind, sort of work past the difference between the price of a test and all the other costs that are associated with drug testing like we've explained?
Yes, they are. And in some instances, they may understand that it costs more, but their comfort level is still with urine. They appreciate that information. But sometimes we're planting seeds, and sometimes we are helping an employer make a decision right then and there about the true cost.
Okay. Another question. When it comes to impairment or detecting impairment, we know that from a legal standpoint, the courts have sort of shied away from saying that a drug test proves impairment, but certainly a company can define the term under the influence as testing positive. But one of the advantages of oral fluid testing is that window of detection opening up immediately after usage. And so in terms of being able to detect somebody who really is, even if we're not using it from a legal standpoint, impaired on the job, Does that ever come up with companies that you're working with where they're concerned about individuals who maybe are coming to work or under the influence, or who are using drugs somehow at work and they're under the influence? And does oral fluid testing become a part of that conversation?
It does become a part of the conversation, and what I struggle with sometimes is some employers need guidance as to how to recognize signs and symptoms of drug and alcohol misuse or impairment. It seems like they need a lot of education in that particular area, but they do want they do appreciate oral fluid as a means of, if they're ready to act, they appreciate the fact that they can get a more accurate picture as for early impairment.
Okay. Had a question. I'll answer this one. Why won't DOT accept oral fluid testing? And actually, I think that's going to change. It's not going to change overnight, as I said earlier, but we are getting to the point where the federal government is developing regulations for lab-based oral fluid testing, not for instant oral fluid, but for lab-based. And DOT will permit, or they've at least signaled, that once the SAMHSA regulations change, they will permit lab-based oral fluid testing. Does that ever come up, Joanne, with the companies you work with?
Absolutely. And as a matter of fact, because it is becoming more common knowledge that the DOT is currently considering oral fluid, employers feel that confidence and they are more willing to accept the idea because the DOT is in the process of evaluating it.
Okay. Have a question that maybe, Joanne, you'd like to handle. It makes sense it would be more difficult to cheat with an oral fluid-based test, but do people still try to cheat?
Well, it's interesting. I have not, in my time over the last 10 years in marketing oral fluid, I have not had anyone try to cheat on an oral fluid. Certainly our MRO and our medical director has, when we've had various meetings with OraSure, we've discussed, like, how could someone cheat on an oral fluid test? And some of the instances where individuals kept repeatedly dropping the specimen on the floor so that a new kit had to continually be to be utilized. But really, it's we have not had anyone try to intentionally,
cheat,
tamper with their device.
Okay.
And surprisingly, when individuals come in, the testing office is near my office, and it's interesting how, especially from a new hire standpoint, when individuals sit down and the collector explains that it's going to be an oral fluid test, a lot of them are surprised because they always say, "Oh, I was expecting to do a urine test." So
interesting.
Yes, it is quite interesting.
Now, I think we've got time for one last question, and I'll take a stab at it, but it's really sort of agreeing with something that Joanne said earlier, which is, in policy development, when identifying the specimen type for testing, is it appropriate to have language stating including but not limited to urine, saliva, and hair? And I will say this, that here at our company, WFC and Associates, that's our core business, is writing drug testing policies. And we always start out that way. We always start out by putting all the options into the policy, and we only narrow it to one specific type if the client insists on it. But we will always mention, that as a company, we do, lab-based oral fluid testing, but we reserve the right to do urine and hair testing also. Anything to add to that, Joanne?
No, I agree, and that's when I meet with legal counsel, that's how they write policies as well. Okay.
Well, thank you, Joanne. We're out of time. I'm going to turn it back over to Jessica, but before I do, There were other questions that we couldn't get to today. I apologize that we ran out of time, but we will address all of your questions offline. So if you didn't get your question answered, we will come back to that. In closing, I want to thank Orasure Technologies for hosting today's webinar, and CRL, of course, and Shawnee Mission Corporate Care for co-sponsoring today's webinar. And again, thank you, Joanne, for co-presenting. You did a great job. And now we'll turn it back over to you, Jessica.
Thank you.
Thank you, Bill. Thank you, Joanne. On behalf of Orasure Technologies, we hope you have found today's presentation informative and helpful. This presentation was recorded, and you will receive instructions informing you how to access the recording. Thank you for your attendance today. This concludes today's webinar.